Update on the acceleration of Alberta's vaccination program. I've said before that we are in a race between the vaccine and the variants. Right now, the variants are winning that race. The third wave is hitting us hard, and cases continue to rise sharply. Last week, Alberta implemented aggressive but necessary measures to keep people safe and to protect our healthcare system by returning to step one of the four-step framework to protect the health system and reduce the rising spread of COVID in our province. These measures are designed to buy us time to get enough Albertans vaccinated so we can finally get through this thing and get back to normal this summer. Vaccines remain our best hope. We have, I believe, one of the best programs in Canada, and I'm pleased to say that as of yesterday, more than 850,000 doses have now been administered. More doses means catching up to this variant spread, and once the vaccines beat the variants, we get our freedom back. I shared this slide last week, and it's worth highlighting again. Every day, tens of thousands more people gain immunity to the virus through the vaccine rollout. In the coming weeks, we'll be able to say that almost a quarter of Albertans have some degree of immunity either through the vaccines or from prior infection. By the end of May, it's expected to be almost half with that level of protection. And by the end of June, we anticipate that about 2/3, and by mid-September, almost 3/4 of Albertans will have protective immunity. We're nearing the end of a long and tiring journey. It is our path to recovery and freedom. Right now, we're in a transition period, fighting to keep control of the virus just a little while longer until it's vanquished by vaccines. As more people become immune, we'll be able to get back to normal faster. When about half of us have immunity, we're hoping to be able to raise capacity limits for gatherings. We're anticipating that we'll be able to gather together in larger groups, and while some restrictions may remain, but not anything like right now. Once 2/3 of us have immunity, we'll start to feel back to normal. There will be no formal restrictions, stampede, sporting events, other festivals will be possible, especially if outdoors, likely with certain public health precautions. Masks and distancing will be part of our lives, but only encouraged and not mandated. Then, once 3/4 of us are immune, we expect we'll be fully back to normal. But all of this relies on the supply of vaccines, and thankfully it's finally increasing. In the last couple of weeks, Alberta's received more than 500,000 doses of vaccine, and we expect to receive another 250,000 this upcoming week. With supply increasing, Alberta's government is expanding distribution of doses at a record pace. In the last week, Alberta's undertaken multiple steps to increase vaccine distribution. We fully opened Phase 2B to more than 650,000 eligible Albertans who have underlying health conditions. We opened bookings for the AstraZeneca vaccine last week for Albertans between the ages of 55 and 64. We opened Phase 2C to more than 240,000 healthcare workers with bookings starting this morning. And we opened rapid flow-through clinics in Grand Prairie, Fort McMurray, Red Deer, Lethbridge, and Medicine Hat. And I'm pleased to announce that today we're opening huge rapid flow-through clinics in Calgary and Edmonton. I joined Dr. Hinshaw and Mayor Don Iveson to tour the Edmonton Clinic this weekend at the Expo Centre, and it's a sight to behold. Supported by hundreds of healthcare workers, both the Calgary and Edmonton clinics will be able to administer up to 1,000 doses per hour and 6,000 per day in each of those two mega clinics. This is a huge addition to our vaccine program. So starting at 12:30 this afternoon, in just over an hour, the Edmonton and Calgary Rapid Clinics will begin inoculating people between the ages of 55 and 64 with the Oxford AstraZeneca vaccine. In addition, we now have more than 1,300 pharmacies and 103 immunization sites administering the vaccine, and more coming on board in the coming weeks. The province is now on pace to administer more than 300,000 life-saving vaccine shots per week. Our stretch goal is to administer upwards of 500,000 a week, But all of this will depend on how many people come forward to get vaccinated. And particularly, we're concerned about potential uptake on AstraZeneca. So we'll have to wait and see, but the capacity will be there to deliver. We expect to read more than 119,000 doses of Pfizer vaccine every week until early June, when this should jump to more than 225,000 a week. We'll also receive more shipments of Moderna vaccine and hope to get the first shipment of Johnson & Johnson vaccine by early May, though we're still waiting for a specific date from the federal government. The benefit of that vaccine is it's a single-dose protocol. As more doses arrive, we will keep accelerating our rollout. Starting today, select participating pharmacies will also be allowing walk-in bookings for eligible Albertans aged 55 to 64 for shots with the AstraZeneca vaccine in Edmonton and Calgary rather than just by appointment. Over 684,000 Albertans have now received at least one dose of vaccine, helping to protect them from severe outcomes and reduce the spread of COVID-19. Alberta Health and the Alberta Medical Association are working together to incorporate physician clinics into Alberta's vaccine program. We'll have more to say on this soon. All adults in Alberta will be offered a first dose of vaccine by the end of June, provided that those doses arrive as scheduled. So thank you, and with that, I'll be happy to take your questions. I will just note that the rapid flow-through clinics that are starting up at 12:30 this afternoon in Edmonton and Calgary are for by appointment only. And again, for folks between 55 and 64, regardless of whether they have underlying health conditions, we encourage people to register online, and it's an opportunity possibly to get vaccinated this afternoon, tomorrow, if you're in that age group. And I should say that people in that age range are susceptible to negative health outcomes, particularly from the new variants that are becoming more dominant in Alberta. And finally, let me point out that every scientific authority around the world assesses the AstraZeneca as being a safe vaccine. The reality is that there have been no reported cases of blood clots here in Canada, and in Britain, I believe over 10 million doses of AstraZeneca have been administered with only 30 negative blood clot cases. And so the risk of not getting vaccinated, the risk of COVID-19 is massively higher than the reported risk of blood clots for people under the age of 55. So the strong medical and scientific advice for folks in that age range is to use that. Please do it as quickly as you can to help us get this under control. And with that, I'm happy to take any questions from the media.
Good morning. We have time for 2 questions off the top, or 1 question and 1 follow-up. With that, operator, can you please put through the first caller?
Rick Bell, Calgary Sun.
Good morning, Premier. I have a question and a follow-up, but I'll ask them one at a time so it doesn't get too confusing. Speaking about confusing, a lot of my readers are kind of just confused about the specifics of how do we get back to fewer restrictions. I know you've talked about immunity in the past days, but you know, the previous plan sort of had those hospitalization benchmarks, and they were kind of, you know, easy to understand. So if you could explain to people what do we have to achieve, or what has to be seen before, let's say, restaurants, bars, and coffee shops open inside, or some of the other restrictions are lifted. How do we get there? What has to be seen?
It's actually, the answer, thanks Rick, is very simple. We have to see the numbers start to come down. Right now they're going up at a pretty alarming pace. Right now we're on track to hit probably 2,000 average daily cases in the near future, and quite possibly 20,000 active cases. Based on the active case to hospitalization ratio, that would imply about 500 to 600 people in hospital. So that's why we've had to bring in targeted measures, because if that number were to continue to increase, if we were to hit, for example, 40,000 active cases in Alberta, then we would be blowing well past the capacity of the healthcare system. So what we need to see is that those numbers come down. So we need to like before, we need to bend the curve. We need to see a decrease rather than an increase on a sustained basis of the daily new cases and the total active cases. Once we can see that on a sustained basis, let's say for a period of a couple of weeks, then we can safely assume that the vaccines are starting to win, and then we can start moving to relaxing restrictions again. And I showed you in this in the presentation here what we're projecting in terms of the protective effect of the vaccines plus the immunity through natural infection. And what it tells us is, based on our projection, by the end of May, we'll be hitting about 48%, nearly 50% protectiveness. And at that point, I think we can look forward to raising capacity limits, to larger gatherings, to potentially relaxing some business rules. And so I think that you know, if Albertans rise to the challenge and do everything they can to stop social interaction and transmission, I believe that we'll be on track about a month from now to look back to relaxing measures as we have the protective effect of the vaccines. But right now, things are going up. It would be, I think, irresponsible to risk blowing out the healthcare system. And I know, Rick, that sometimes you and others say that those are just, you know, fear tactics. Look, as Dr. Hinshaw says, we shouldn't fear COVID-19, but we should respect it. And we should take a real look at what's happening in the rest of the world, like Ontario right now, where they are dangerously close to their maximum capacity in intensive care. There is a very good chance that Ontario will have to triage patients, which means basically deny critical care to COVID patients as early as later this week. We don't ever want to be in that situation in Alberta, especially at the end of this thing after all these sacrifices have made. So the very simple answer to your question is, we've got to see the numbers start coming down.
My second question is more of a political question, though it is related to COVID, is I know you've spoken in the past about respecting freedom of speech and diversity of opinion, so this question really isn't about that because you've already spoken on that. But what message do you have? What do you actually say to people? These could be your own people, your own MLAs, your own elected people on the United Conservative benches, or people who are party members of the United Conservative Party, or people who voted in 2019 for you and the United Conservative Party in the last election. So for those people, many of whom express displeasure with what you're doing and don't like what you're doing, what do you say to those people today?
Well, I would say I don't like what we're having to do either. None of us like this. But if the alternative is blowing out our healthcare system, mass cancellation of surgeries, a potential surge in preventable deaths, that is not morally acceptable. We have searched for every alternative tool. We have had less stringent public health restrictions than the vast majority of places around the Western world. We have treated restrictions as a last and limited resort. We've never gone to hard lockdown. We've never had curfews and stay-at-home orders. We've been the only province in Canada that never locked the churches and places of worship, with the exception of 1 out of 10,000 that flagrantly has refused to operate safely. We have had the schools open for in-classroom instruction for 700,000 students since August. We have had less stringent restrictions for businesses than most provinces and U.S. states and European countries over the past year. And so I would say we have tried to take a balanced approach because of our Alberta belief in freedom and personal responsibility. But abstract political principles don't stop people from piling up in intensive care units and threatening the limited capacity of our healthcare system. We've done everything we can to expand the capacity of that healthcare system. We believe that if required under pressure, we can double the number of staffed ICU beds that are available, but there is a limit to that. So I would say to those folks who are upset, I hear them, I truly share their frustration. This has been incredibly painful for all of us. I've had to make decisions with our cabinet I never in my life imagined having to make, but we truly concluded that there has been no credible alternative to avoid large-scale preventable deaths and an overwhelming of the healthcare system. I would say to them, if they know someone in their family or circle of friends who is waiting for breast cancer surgery, is waiting for heart surgery, do they really want us to take the risk of being forced indefinitely to cancel that surgery because we have to move staff from the operating rooms to intensive care? I think the vast majority of Albertans, if they were in our position as decision makers, would make very similar decisions, balanced decisions to protect lives while minimizing the impact of restrictions on society.
Operator, can you please put through the next question?
James Keller, Globe and Mail.
Hi there. I just had a question about the vaccine timeline. I know that the province's goal, really every province's goal, is to have enough vaccines to make it available to everyone by June 30th. So why is the projection that we'll have between 2/3 and 3/4 coverage by September? What's the delay and the lag there?
Yeah, that's not, James, to be clear, that figure is protective coverage. It's not vaccines administered. There's a difference because according to our epidemiologists, Dr. Hinshaw and her team, the vaccines, of course, as you know, the vaccine does not provide 100% protectiveness. And that is particularly true for the first dose in the double dose vaccines. So, when we talk about one dose for all adults by the end of June, that does not mean 100% protective coverage. In the case of the first dose, I believe on the Pfizer, the estimated protective effect from severe health outcomes is in the range of 85%. Moderna is a little bit lower, I believe. And so you don't get to 100% protective effect from potential disease as a result of the vaccine administration. It doesn't eliminate the possibility of negative effects. So that's why when we get to September, you don't get, it takes a while to, and the other thing, of course, is the lag effect, taking 2 weeks on average for each dose of the vaccine to develop their full protective effect, and 3 weeks in the case of elderly people. So a lot of what you're seeing is that you don't get to 100% protection on all the vaccines, certainly not on the first dose, plus the lag effect. I hope I made that clear.
James, do you have a follow-up?
Totally. I just want to switch the issue of schools. You spoke about this on the weekend, this idea that transmission in schools is still relatively low. I know that the age group, 10 to 19, has like the second highest per capita infection rate right now in the province, second only to 20 to 29, and just barely. If schools aren't driving now, what's your theory as to why that group seems to be having such a high rate of infection? Where's that coming from? It seems to not be affecting kind of the age that you'd expect their parents to be in.
Well, we see the fastest growth amongst people in the 20 to 29 age group, quite high growth in the 30 to 39 group. And you're right, amongst teenagers, it's higher. And I think the answer to all of the above is primarily socializing. As Dr. Hinshaw's expert view on this is the same as public health experts across the country, and I believe around the world, which is that the amount of in-school transmission is tiny. I gave you the number on Saturday. I think it was something like 1,370 cases of in-school transmission since schools reopened in January, which is much less than 1% of the 700,000 students in school. So the problem there does not appear to be in-school transmission. I think the teenagers in particular have a tendency to socialize, understandably. You know about one case in Calgary where we had to suspend the operation of a high school because kids there had a number of house parties where transmission occurred. I was just briefed that we did have to suspend schools in Athabasca County, a couple of them, or a few of them. Again, it was out-of-school transmission. In one case, a bunch of kids from one of those schools were brought together by their parents for a birthday party. And apparently, the virus had a 100% attack rate at that birthday party. All of the kids who came to that birthday party got sick, and so it was social activities outside the school that led to that transmission. The Department of Education is following this very closely and is in daily contact with superintendents and school boards, determine if junior high schools and high schools in particular need to move to online instruction if those particular schools face a significant wave that impairs their ability to operate. But as a general rule, the vast majority of school boards want to continue offering online instruction. We think that they are right to do so. As you know, there is a growing body of data that children have been significantly set back in their learning over the past year because of the interruption in classroom instruction. So I'll say it again, that the last thing we should suspend, in my view, is the opportunity for in-classroom instruction.
Operator, can you please put through the next question?
Dean Bennett, Canadian Press.
Good morning, Premier. Clearly, the debate on COVID will continue in the House for quite a while. However, we've got a speaker who is now on record opposing government policy. Can Nathan Cooper, in your mind, effectively moderate debate in the House, given his public stance against the government policy re-COVID health restrictions?
Well, that is a very good question that I encourage you to put to the Speaker. As you know, Dean, the neutrality of the Speaker is an essential aspect of our parliamentary system. The Speaker must be both neutral and seen to be neutral, which is why the long-standing tradition that goes back hundreds of years is for the Speaker to avoid taking positions on current and contentious political issues. Because the Speaker does have a responsibility to represent the whole House and not a faction of the Assembly. So I believe there's a very good reason behind that. It doesn't preclude speakers from exercising their representational role in for example, in advancing constituency case files with ministers or local issues and interests. But the long-standing convention, of course, is for speakers to scrupulously maintain their neutrality. And in my 24 years as a parliamentarian, I cannot ever recall a speaker having violated that until last week.
Dean, do you have a follow-up?
Yes, thanks. Premier, can you explain to Albertans the context for your comments to caucus last week about calling a snap election? Hard to imagine that being a very responsible move in a pandemic.
Yeah, I did not say that, Dean, and I agree with you. The last thing we need is an election. We need stability to get through the balance of this. And beyond that, I'm not going to comment on what you know are confidential discussions within caucus.
Operator, can you please put through the next question?
Chris Varco, Calgary Herald.
Hi, Premier, this is a question off topic, but I want to just ask about the federal budget coming out next week. What are you specifically looking for in the budget, and have you received any signals from Ottawa with regard to your requests for, I think it was $30 billion and some sort of assistance for carbon capture, utilization, and storage?
We've had very encouraging discussions with the federal government, particularly the Department of Finance, on a potential partnership in massively expanding incentives for carbon capture, utilization, and storage. As you know, the United States has kind of stolen the march on us when it comes to CCUS because of a very attractive tax incentive in the U.S. tax code. I think it's called 46Q, if I'm not mistaken. And there's now a bill before Congress to expand that and actually turn it into a grant. Because of that, the U.S. has really hyper-boosted their CCUS industry. And our message to the Government of Canada is, if you want to achieve your emissions reduction targets, then you need to address one of the biggest industries in the country, the Canadian oil sands industry. And you're not going to be able to punish your way to achieving your emissions reduction targets through things like instruments like carbon taxes. It's just not going to happen. As we've said, it's all the path to achieving meaningful reductions in emissions has always been through the application of technology. I think Alberta has been vindicated with our early generation investments in carbon capture technology. The Quest facility, the Alberta Carbon Trunk Line that is now operating has sequestered its first 1 million ton of CO2. And so we've got the technology, we've got the workforce, we've got the upstream producers who are keen to participate. We've got the midstream folks who are willing to expand things like the infrastructure like the carbon trunk line. But what we don't have are the right incentives. And so we are hopeful that in next week's federal budget, there will be a significant new incentive for CCUS investments. We'll continue to do our part as a government by continuing our investments in the technology through the TIER program. Without it, the Alberta government, the Quest program, and the ACTL never would have happened. So I hope we can get a kind of tripartite partnership between Alberta, Canada, and the industry and really see this take off.
Chris, do you have a follow-up?
Just curious whether you can give us any update on your discussions with the federal government regarding funding for a new jobs or training program that was mentioned in your own budget back in February.
Yeah, we've been in discussions with them for 3 months on that, I guess more like 6 months, come to think of it, since the fall. And we have been pushing a reboot of the job training programs that are available. These typically are done on historically, the federal government is almost the only funder, but we are prepared to step up as a provincial government with some substantial dollars to complement the federal transfers. But what we're asking for us is a little bit more flexibility for an employer-driven program. I think the best kind, you may recall I was the federal minister of employment, so I'm pretty passionate about this issue. I actually rolled out the Canada Job Grant in the federal government, which has been, I think, a real success. We want to kind of build on that model because the data tells us that the most successful job training programs are ones that are led by the private sector. They know what kind of skills they need. And we need to incentivize the private sector to put more skin in the game. I think it's tragic that Canada is at the bottom of the developed world, according to the OECD, in employer investments in job and skills training. So the program that we have proposed to the feds is a kind of expansion of the job grant, which would require that employers put some skin in the game. So imagine a new tech company in Calgary comes to us and say that they foresee the need for 200 coders in the next year, and they're prepared to put up 25 or 35% of the relevant training costs. And they have a partner, be it SAIT or another one of the colleges that's willing to deliver a tailored program, and they're willing to give them on-the-job experiential learning. Then we can come in with the feds and pay for the balance of those costs. So that's the kind of program we've been trying to develop through called Alberta Jobs Now. And a number of other provinces have been also seeking greater flexibility. The feds have given us positive signals, but they told us that they wanted to wait for their budget to finalize this. So that budget's next week, and we are hopeful that there will be positive news and we'll be able to proceed with launching the Alberta Jobs Now program.
And we have time for 2 more questions. Operator, can you please put through the next caller?
Michael King, Global News.
Hi there, Premier. I wanted to touch on something you said right off the top there. You said that Alberta has one of the best vaccine programs in Canada. How can you justify this when we have the fourth, by my count, the fourth lowest vaccination rate per capita in the country?
So you can expect updated data later today. I asked exactly that question to our senior health officials who briefed me that they've been having reporting problems from Blue Cross and from the pharmacies. For example, the numbers that you've seen to date do not include tens of thousands of doses that have been administered by pharmacies and other partners. So please just stay tuned for an update, a retrospective update on the data of how many have been delivered. But we believe that we are at least competitive with other provinces in terms of the per capita administration, and that will accelerate with the opening of the rapid flow-through clinics in Edmonton and Calgary today, in Grand Prairie, Lethbridge, Red Deer, and Fort McMurray last week. And the other measures that we have taken, including opening up for 250,000 healthcare workers, the possibility of vaccination beginning today, the walk-in opportunity for pharmacies to deliver the AstraZeneca. So the pace will be accelerating, but again, I'm told that the data you're referring to is incomplete. I can't say I'm happy about that because I think we should be celebrating our successes here, and I've been assured that they're going to fix the reporting problems that exist.
Michael, do you have a follow-up?
Yeah, something a little bit more specific. Calgary's fire chief was in front of City Council just an hour ago saying that because of recent cases there and isolations, it's impacting their resources. What scientific proof is there that moving up firefighters who respond to COVID-19 calls every day would not be beneficial for the community?
Well, I believe some people who work in fire departments with certain paramedic responsibilities have already been given access to the vaccine, particularly if they're involved in clinical interventions such as intubation. And starting this morning, a large range of other paramedics, effectively I think all the other paramedics can register for vaccination. And apart from that, we continue to follow the advice of both the national and the provincial scientific advisory councils on the vaccine program. Their advice has very much been to focus on people who are vulnerable to severe health outcomes from COVID-19 or those who might be in at the highest risk for transmission, like nurses in ICU units. So I'll remind you that if we were to say that in the context of a scarce number of vaccine doses, if we were to say that a healthy, robust 25-year-old firefighter gets into the vaccine queue ahead of, right now, a 65-year-old with chronic conditions, that in no way reflects the real risk profile here. Young, healthy people generally are not negatively affected. They can be, but in a tiny number of cases. But the higher you go up in the age spectrum and the more chronic conditions that you have, your chances of negative outcomes increase massively. So that's why Dr. Hinshaw and the Alberta Scientific Advisory Group, plus the federal one, have all advised that in a world of scarce doses, we focus on the people who are most vulnerable to negative outcomes. And one positive that we can see in this challenging time is a reduction in the fatality rate because we did focus on the very elderly, and now you can see the infection and fatality rate not only coming down for people over 80, but also people between 65 and 84, or sorry, 65 and 79. So that's encouraging.
And operator, can you please put through our last caller?
Charlotte Demulin of Radio Canada.
Oui, bonjour, M. Kenney, en français maintenant. Donc, première question pour vous. Vous dites qu'on pourrait lever toutes les restrictions au cours du mois de juin et que même les festivals pourraient avoir lieu. Donc, pour clarifier, quel est votre message pour les organisateurs qui, à ce moment-ci, voudraient préparer leur festival de cet été?
Le message est qu'il y a un grand espoir que nous pouvons avoir les festivals à l'extérieur cet été, mais évidemment dans le cadre de certaines balises. Et les grands festivals travaillent de près avec le ministère de Santé pour développer ces balises pour les événements cet été. Alors, nous croyons, si nous obtiendrons les doses des vaccins, qu'il y aura la possibilité des événements, comme j'ai dit, dans le contexte de certaines balises. Il faut finaliser les détails à cet égard, mais je suis confiant que ça ne serait pas un été normal, et ça ne serait pas un été comme auparavant, mais ça sera un été beaucoup plus libre et ouvert que l'année dernière.
OK, merci. Et ma deuxième question pour vous, M. Kenney, c'est par curiosité, en fait, parce que on ne sait pas combien de temps exactement dure l'immunité des personnes infectées par le virus, même que les experts suggèrent que les personnes qui ont déjà été infectées devraient aussi être vaccinées. Donc, pourquoi mélangez-vous les statistiques des personnes infectées et vaccinées pour évaluer le niveau d'immunité de la population?
Parce que de plus en plus, les recherches indiquent que l'infection naturelle crée pour les personnes un niveau de protection important. Mais quand même, on va continuer avec le programme de vacciner même ceux et celles qui ont été infectés auparavant. En particulier parce que la variation du virus P1, ça veut dire la variation brésilienne, peut défaire effectivement l'immunité naturelle qui vient de l'infection. Alors, il faut continuer de vacciner même ceux et celles qui ont été infectés, mais ils portent un certain niveau important de protection. Alors, ça, c'est l'avis de nos experts, et si vous voulez les détails, au plan scientifique, je suggère que vous posez la question à la Dr. Hinshaw.
Thank you, everyone, and that concludes today's event.
Thank you very much.